Sir, we'll wait for a few minutes to enter our all participants, and then we will start. Sir, am I audible?
Ma'am, you are audible.
With the blessings of Saraswati Mata, we will start our program today. For the guidance regarding overview of antibiotics, pharmacology, and medicinal chemistry. This is very important topic for GPAT and NIPER as well. So I hope all the students will take utmost benefit of the seminar given by our Chief of Gesture, Dr. Amit Lunkad sir. Before that, I would like to introduce our Chief of Gesture, Dr. Lunkad sir. Dr. Amit S. Lunkad sir, currently working as Associate Professor in Department of Pharmaceutical Chemistry, Sitabai Thite College of Pharmacy, Shirur. He has completed his graduation from University of Pune, M.Pharm from RGUHS, Bangalore, PhD in Pharmaceutical Sciences from Savitribai Phule Pune University, Pune. He also has to his credit 5 books, 3 patents, and number of research papers in reputed journals. He is a recipient of Best Faculty Award from VMH Life. He is having vast experience of Revan, please mute yourself. Revan. He is having vast experience of 15 years in academics, and obviously that will be beneficial for all the students. His YouTube channel named as Amit Lunkad is famous and recently has got monetized. So with this brief introduction, I welcome our Chief of Gesture, Dr. Amit Lunkad sir, to please illuminate us with your vast knowledge in the area of antibiotics.
Thank you, madam, for a good introduction of mine. And I'm very happy to use this platform to get students get obvious benefited with this. So, madam, please allow me to share the screen.
Yes, sir.
Make a host to me, so I will share my screen.
Yes, sir, I have given that. Please try to share your screen.
Here message comes, you cannot start screen share while the other participant is sharing.
Yes, sir, please try again. Sorry for the inconvenience.
Yes, madam. Yes, screen is visible.
Yes, sir.
Okay. So, all of you know that in GPAT, the pharmaceutical chemistry having a weightage of 152 marks. That is around 38 questions asked on this pharmaceutical chemistry. So it's very important to know the basic of your medicinal chemistry as well as the pharmaceutical chemistry. Here today I introduce this medicinal chemistry topic, antibiotics, which is very important one. So as all of you know, antibiotics are nothing but the compounds which can be used to kill the other microorganism, and itself it is prepared from the one microorganism. So let's begin with this, some historical part of the antibiotic. Sir Alexander Fleming, which can be accidentally discovered the antibacterial properties of penicillin in 1929, and he is known as a father of antibiotic. So I just introduced this first definition of this antibiotic. The antibiotics, which is an derived from word antibiosis and which having a ability kills the another microorganism and it will prepare from one microorganism. But this definition, which is not as such limited, we can classify antibiotic in different conditions also, like if it is a product of metabolism or the synthetic product produced as a structural analog of a naturally occurring antibiotic, if any compound having antagonize the growth or survival of other species of microorganism or which is effective in low concentration, then this substance is also be called as an antibiotic. So you have to remember antibiotic, which is a mainly acts as an antibacterial agent, and in some cases it can be also used as a antiprotozoal agent. So remember this point. So now about classification of antibiotic. If you know the classification, it is quite helpful to answer the questions. Give the example of narrow spectrum or which one is the broad spectrum antibiotic. So you must remember the classification of an antibiotic. There are the different ways of classification of antibiotic, like according to spectrum of activity, according to source, according to mechanism of action, and as per its structure. So as per the spectrum of activity, we say it as a narrow spectrum antibiotic and broad spectrum antibiotic. Narrow spectrum antibiotic means which are effective against either gram-positive or gram-negative microorganisms. Example of narrow spectrum antibiotics like penicillin, cephalosporin, erythromycin, whereas broad spectrum antibiotics are effective against both gram-positive as well as gram-negative microorganisms. Example like chloramphenicol, tetracycline, cephalosporin. So this is the one way of classification. Another way is as per their source. As we all of you know that antibiotics which are prepared from one microorganism and effective against another one. So you must know the source of that antibiotic. So there are the different source, like it can be obtained from fungus. Example of drug like penicillin, rhizophlavin, obtained from actinomycin like tetracycline, chloramphenicol, aminoglycosides, bacteria, example like bacitracin, polymyxin. So these are the sources of different sources of your antibiotic. Some antibiotics are also semi-synthetic one, like semi-synthetic penicillin, cephalosporin. For this semi-synthetic penicillin, which can be obtained from reagent like 6-aminopenicillinic acid, whereas semi-synthetic cephalosporin can be obtained from 7-amino-cephalosporanic acid. We discussed later on, and some are totally synthetic one. We can synthesize in lab. Example is chloramphenicol. So another way of classification is their as per their mechanism of action. So here is the structure of microorganism. It having cell membrane, then it was having a cell wall, then genetic material. So these antibiotic will act to these different sites. Like it will be acts to cell membrane, it can be inhibit the metabolism, then it will inhibit the cell wall synthesis, then also it will inhibit the protein synthesis. So the example of respective under heading is or different mechanisms are like if it inhibit the cell membrane, examples of cell membrane inhibition antibiotics are polypeptide and pollins. Example of pollins like amphotericin B, nystatin, polypeptides like polymyxins, clostine. If it inhibit the metabolism of or inhibit the process of metabolism. And there are the different examples. Broad classes are sulfonamides, sulfose, trimethoprim, para-aminosalicylic acid, pyrimethamine, and ethamitol. So these examples are these sulfonamides are a synthetic one. Then some are inhibitor cell wall synthesis, like beta-lactam antibiotic, cephalosporins, penicillin, vancomycin. If it will act by another way, like misreading of mRNA, is responsible for killing of bacteria. Like example, aminoglycosides, streptomycin, gentamicin. It will also inhibit the protein synthesis. The inhibition of protein synthesis by different way, like it acts on subunit 30S ribosomal subunit or 50S ribosomal subunit. Example like tetracycline, aminoglycosides, microlide, clindamycin, chloramphenicol. Some will also inhibit the DNA gyrase enzyme like fluoroquinolones and inhibition of cell membrane fluoroquinolones and rifampin or rifampicin. So if you remember this mechanism and the example, which is also very useful to you. So moving to the next one, as per, okay, so these are the as per mechanism of action, and here are the many more examples under the heading. Next, moving to the chemical classification, means the ring or the chemical structure of antibiotic having like beta-lactam antibiotic, penicillin, cephalosporins, aminoglycoside, streptomycin, gentamicin, tobramycin, tetracyclines like tetracycline, chlortetracycline, doxycycline, macrolide, erythromycin, azithromycin, lincomycin, clindamycin, polypeptides like vancomycin, bacitracin, and unclassified antibiotic example is chloramphenicol. So as all of you know, here we go in detail about each class. Beta-lactam antibiotic. So can you tell me about beta-lactam antibiotic means what? Anyone? Hello?
Yes, final year students, please interact.
Anyone? So the in front of you the screen is visible. So beta-lactam antibiotic means it having a beta-lactam ring, and this beta-lactam ring is nothing but a four-membered cyclic amide ring. So if you see here, so this is the beta-lactam ring, and which is nothing but a cyclic four-membered amide ring, amide N C double bond O. So this example of beta-lactam antibiotics are penicillins and cephalosporin. Here is the classification of beta-lactam antibiotic. We classified as penicillin, cephalosporin, which is the major subclass, then carbapenems and monobactams. Penicillin, like different examples come under penicillins like methicillin, penicillin G, penicillin V, oxacillin, floxacillin, dicloxacillin, piperacillin. Whereas cephalosporin we can further classify as first generation, second generation, third generation, fourth and fifth generation cephalosporins. Carbapenems like bipenems, ertapenems, imipenems, panipenems. So these carbapenems are nothing but the which having beta-lactam ring fused with a five-member ring, but this fifth five-member ring which is unsaturated one and it doesn't having a sulfur atom. And monobactams means it contains only a beta-lactam ring. Example like monobactams are Asprionam, Tigimonam, Nocardicin, A, Tarumonam. So all these are the examples with subclass of beta-lactam antibiotic. Now moving with the beta-lactam antibiotic mechanism of action. So as all of you know, it will inhibit the bacterial cell wall synthesis. But how it will inhibit that bacterial cell wall synthesis? So the basic mechanism involved is inhibition of biosynthesis of dipeptidoglycan. This dipeptidoglycan which provides a strength and rigidity to the cell wall. The penicillin and cephalosporin which get acylate a specific bacterial D transpeptidase. So this penicillin cephalosporin which acylate the D transpeptidase, and this enzyme which is important one for forming the peptide cross linkage of the two linear peptidoglycans strand, so it forms a dipeptidoglycans. So this form transpeptidation get formed and there is a loss of D-alanine. So this is the role of transpeptidase enzyme to form a cross linkage. And as this penicillin, cephalosporin or other beta-lactam antibiotic which will inhibit that cross linkage and therefore it loosens the strength of that bacteria and therefore because of that the no more bacteria get survive. So this is the mechanism of action of beta-lactam antibiotic. So first one is about penicillin subclass which is obtained from a fungi. So penicillium fungi which is the source of this penicillin and two strains of fungi can be used, Penicillium notatum and Penicillium chrysogenum. So this penicillin which is very significant one and which can be used in which is the first drug used against the very different serious diseases such as syphilis and other infections caused by staphylococci as well as streptococci. So all penicillins which are used in bacterial infection which is susceptible usually to gram-positive organism. So it is as such effective for against gram-positive microorganism. So it is having a narrow spectrum antibiotic, but we can be expand its spectrum by doing some modification. We discuss in next slide. So next is about its structure. So as all of you know, this beta-lactam antibiotic example penicillin, which are having a beta-lactam ring. So the beta-lactam ring fused with a thiazolidine ring. So this question is also asked in GPAT, which heterocyclic ring present in penicillin. So remember, there are the beta-lactam ring fused with a thiazolidine ring, and so it forms a phenol ring, and further it having a presence of 2-methyl group and COH group. It is called penicillinic acid. And if you do the numbering like sulfur priority 1, so here it comes a 6th position, and if to this 6th position amino group is present, then it is called 6-amino penicillinic acid. So in this structure, basic structure of penicillin, you get that the penicillin which are having a beta-lactam ring, thiazolidine ring, and to the side chain it having a acyl side chain, and to the 6th position having amino group, and combined it is called 6-amino penicillinic acid. So one more point you have to remember in that the penicillin which is derived from a cysteine and valine amino acid. If you break this here, so you will get that to the one side it having a one amino acid and here another amino acid. So this one is the sulfur containing amino acid which is the cysteine, and here is the valine. So penicillin which is derived from cysteine and valine amino acid. The nomenclature, yes, on this also the question is asked what is the name of or ring present in that penicillin as well as its chemical name. So there are the two ways of numbering to this penicillin, as it is a example of bicyclic heterocyclic ring system. So it having a bicyclic heterocyclic system. Bi means two and cyclic means it contains a two cyclic ring. Two cyclic ring get fused. And we can do a numbering to this bicyclic ring by two ways. First one is as per the chemical abstract system, in which we give the priority to sulfur, means we give the first number to the sulfur, and accordingly we give the numbering. So sulfur having 1, nitrogen 4, and this amino is to the 6th position. So name is 1 thia means sulfur, 4 aza
Actually, there is some network issue. Please rejoin again with the same link. Sir,
madam.
sir, please rejoin with the same link. There is some network issue.
Okay, so I will use this first one.
Recording stopped.
Visible?
Students, please get involved and reply to all questions.
Hello, screen is visible?
Yes, sir.
Okay, so shall I repeat again this nomenclature?
Yes, sir.
Okay. So as all of you know, this penicillin, beta-lactam penicillin, which are fused with a two cyclic rings. So it is called bicyclic. Example of bicyclic, heterocyclic cysteine. Heterocyclic, why it is heterocyclic? Because it contains heteroatom like sulfur and nitrogen. So we in GPAT in 2 to 3 times the question asks you the this name is given and correct name you have to choose from that option. So it's very important to know that. So there are the two ways by which we give the name to that. So first one is by first we give the priority to sulfur and second priority to nitrogen as per the chemical abstract system. So as per chemical abstract system, name is to the first position sulfur, so 1 higher, to the fourth nitrogen, so 4 aza. As it is bicyclic ring system, so bicyclo 320 heptane. So how this 320 comes? So you have to remember that you have to consider this is the bridge head or this is the bridge, and to the bridge you have to give A and B, and to the one side you have 3 atoms. So you have to write 3, and to the another side it having 2. So it is 2, and in this common carbon there is no more any atoms which are present. So it we consider as a 0. So it having a 3 pathways to the bridge in between the common carbon or in between the bridge to one side of bridge and to another side. So it comes 3 to 0. So you have to write in such way in decreasing order. So here is the 3 to 0. Okay, so as it contains 1, 2, 3, 4, 5, 6, and 7 atoms, so it is heptane. And we have given the heteroatom which are present and its position. That's why the name 1 higher 4 aza bicyclo 320 heptane. Whereas as per the United States Pharmacopoeia, we give the priority to nitrogen and second to nitrogen sulfur. That's why the numbering is quite different one. Nitrogen having 1 and sulfur having 4 number. So as per this USP, name is 4 Haya 1 Aza bicyclo 320 heptane. So all of you getting how this 320 comes and what is the way of giving the nomenclature to bicyclic system? Anyone just give the reply?
Yes, sir.
Okay, good. So here, so we can be use a general name as a PENA or the unsaturated bicyclic system according to chemical abstract system. Mostly the chemical abstract system can be used for the nomenclature or mostly they can be used. So as per the chemical abstract system, you may say the in general name is 6 acyl as this having a 6th position, and to the 6th position it having amino group, and to this it having a acyl group. So 6 acyl amino 2,2-dimethyl. This is the as per chemical abstract system sulfur having first position. So this is first, and to the second position it having a 2-methyl group. So 2,2-dimethyl penam 3-carboxylic acid. So this is the nomenclature we can be used for the naming while giving the name to the penicillin. or simply you may say 6-acyl amino 2,2-dimethyl penicillinic acid is also correct one. So some stereochemistry of that. Remember, in penicillin, it having a 3 chiral atoms. Chiral atoms means the 4 different atoms or groups attached to a one carbon. So if you see this carbon where I given a star. So this carbon having a different groups are attached. Like to this carbon, it having hydrogen, COH group, and here is having a just carbon, means substituted carbon. So this position number 3, position number 5, and carbon 6, which are having a asymmetric carbon. So because of that, it having a stereochemistry of penicillin, which can be designated as 3S, 5R, and 6R. And the chemical degradation will take place to the carbonyl group of penicillin as it undergoes readily to a nucleophilic attack by water or hydroxide ion, and it forms a penicilloic acid and which is inactive. So which is reasonably stable in neutral to alkaline solution, but it readily undergoes decarboxylation and further hydrolytic reaction in acidic solution. So other nucleophiles such as hydroxylamine, alkylamine, and alcohols open the beta-lactam ring and it forms a corresponding hydroxamic acid, amide, and esters. And as all of you know that many of the persons or patients which are having an allergy of penicillin. So which is because of a formation of antigenic penicilloyl proteins in vivo by the nucleophilic attack or nucleophilic group on specific body proteins with beta-lactam carbonyl group. And because of that formation of penicilloyl protein, there are the formation or there is some allergic reaction. So whatever here we discuss, here we use this in structural form exactly what happens. So remember that the intact structure of beta lactam, which is very important for showing the action. But if you observe in all the cases, there are the opening of beta lactam ring and it forms a inactive compound. So here is the chemical degradation of penicillin. So here is the some important points of this structural activity relationship. As all of you know, the problems associated with penicillin, like it is a having narrow spectrum antibiotic, so we can be convert it into a broad spectrum by some modification to structure, as well as we can improve as it is an acid liable, so which can be convert it into a acid stable form, so it will be get converted or which can be do with the help of some modification in structure. So under this structural activity relationship, we discuss the point. So firstly, these 6 amino group, here we made the substitution. So firstly about this 6 amino group, the as I already explained that why we made the changes in structure, like for enhancement of activity, for better stability, for in case of suppose it form a resistance, then to improve that, we have to increase the pharmacokinetic of that drug, means absorption. We made the modification to this. So you can be add a carboxamide derived base end, which is tolerated. But if you do this by sulfonation of phosphoramide containing substituent, it doesn't show any antibacterial activity. So here is the acylation we can be do with the help of carboxylic acid. So form compound which is a very potent one and which having the antibacterial activity. So this is structure of penicillin G. Then introducing a more crowded environment around the beta-lactam moiety, then it will form a stable penicillinase enzyme. Means it will be doesn't show action to that penicillinase. Example, methicillin and oxacillin. So penicillinase enzyme which is responsible for the opening of beta-lactam ring. So because of enhancement of crowded environment around beta-lactam, so we'll protect the beta-lactam ring from penicillinase enzyme. So example of this is methicillin and oxacillin. So in that we made a crowded environment around beta-lactam moiety. So here is we just introduce a methoxy group. So form compound is a penicillinase resistant penicillin. Remember that. This methicillin, which is an example of penicillinase resistant penicillin. Moving to the next point is we can expand the antibacterial activity of this penicillin by just making a more hydrophilic base end which can enhance the potency against the gram-negative pathogens. So now it becomes a broad spectrum. So example like ampicillin and amoxicillin. So here you see this is just a amino group to this alpha carbon, and this small modification which enhance the spectrum of activity of penicillin. So it becomes a active against gram-negative microorganisms also. So also we can further expand the spectrum of activity by just introducing a strongly acidic group to the alpha carbonyl center of this side chain, and which becomes a useful against the P. aeruginosa microorganism, like example is carbonicillin. So here is the carbonicillin. Structure is quite similar of this ampicillin and carbonicillin. Just difference is instead of NH2 group, it having a COH group. So remember this modification be done to that penicillin structure, because we in next slide we discuss the classification of penicillin. In that these points are very important one. Now next point is sulfur, which is the atom which should be positioned first and which is responsible for showing a antibacterial activity. If any substitution or any structural changes in basic moiety which can be leads to inactivation of the penicillin. The free COH group which is required for showing the activity, and it must be unsubstituted one. So here we discuss classification, as we already discussed the problem of penicillin. So here under this classification, the points we covered under SAR, which are like, as all of you know, penicillins are acid liable, means it get degraded in acidic environment. So you can be made it acid resistance. So it becomes quite stable in acid. Example of acid resistant penicillins are penicillin G, that is benzyl penicillin, and penicillin B, which is phenoxymethyl penicillin. Then as second one is penicillinase resistant penicillin. Can you tell me the example of penicillinase resistant penicillin? Just now we have seen under SAR. Yes, anyone?
Methicillin.
Yes, methicillin. Good. Methicillin, oxacillin. Then the properties of this is it diminishes the susceptibility to many penicillinase enzymes, and which are active against microorganisms which are quite resistant to early penicillin. Then it having an inadequate spectrum against many gram-negative species. So this is the property of this penicillinase resistant penicillin. Whereas broad spectrum penicillin means which can be active against gram-positive as well as gram-negative microorganism. Yes, can you tell me example of broad spectrum penicillin? Just now we have seen under SAR. Just anyone?
Ampicillin.
Yes, very good. Ampicillin, amoxicillin. Good. So these are the broad spectrum penicillin. So which are having a expanded spectrum of activity against some gram-negative bacteria. And yes, it will retain the gram-positive potency. And that's why it is active against both gram-positive as well as gram-negative bacteria, and therefore it is broad spectrum penicillin. And it is generally well absorbed orally. Ampicillin can be dosed or can be administered by intravenous as well as intramuscular route. And we can be also form a prodrug esters of ampicillin, which can be enhanced the further systemic drug level. Now moving to the next one, which is anti-pseudomonas penicillin. Example is carbapenicillin, ticarcillin. So the property of these anti-pseudomonal penicillins are which are having somewhat extended spectrum of activity against many pathogenic gram-negative bacteria, but it have somewhat reduced gram-positive potency, and it having a good activity against P. aeruginosa. Oral absorption, chemical stability is somewhat problematic for this anti-pseudomonal penicillin. Then next one is the broad spectrum uridopenicillin like polymyxin, amphotericin B, and nystatin. So these are having a extended spectrum of activity against different microorganisms like P. aeruginosa, against Clavicella, Ceratia, and Proteus 1. So now here we discuss individual penicillin in past overlook of this penicillin, individual penicillin like penicillin G. Remember another name for penicillin G, which is benzyl penicillin. So here is the structure. So why it is called benzyl penicillin? Because it having a benzyl group. So this one, which is a benzyl. So it is the benzyl penicillin. Then next one is it can be used for the treatment of a different kinds of bacterial infection, and it is first made available as a water soluble salt of potassium, sodium, and calcium. So these salts of penicillin are inactive by gastric juice and not effective when administered orally. So it can be administered along with the antacids, we may say, like with carbonates, aluminum hydroxide, magnesium trisilicate, or even strong buffer such as sodium citrate. So the water-soluble potassium and sodium salts are used orally as well as parenterally, and which are having most soluble potassium salt when uses in large doses which are required. And remember, the sodium salt which can be preferred in renal failure. Okay, this point is very important one. The sodium salt which can be preferred in renal failure. Next one is the penicillin B. Penicillin B is nothing but phenoxymethyl penicillin. So if you see the structure, so try to remember with the name or with the structure, you remember the name. Like as it is the phenoxy, means phenyl with oxygen, phenoxy, and next is methyl. So this is the methyl. So combined it is phenoxy, methyl, and this part is the penicillin. So it is phenoxymethyl penicillin, that is penicillin B. So it is the problem of degradation by gastric juice which can be overcome by just incorporation of this oxygen atom in between the aromatic ring and this CONH group. So it is maintain a uniform concentration in blood, and its potassium salt is usually used. Okay. So this is about penicillin B. So next one is the methicillin. Yes, it is an example of penicillinase resistant penicillin. So it is very sensitive to moisture, losing about half of its activity in 5 days at room temperature, and refrigeration at 5 degrees reduce the loss of activity about 20% in the same period. So methicillin sodium is resistant to inactivation by penicillinase enzyme. So next one is its uses. It can be used in treatment of staphylococcal infection caused by strains resistant to other penicillin. So in that case, it can be used effectively. It has some adverse effect like incidence of interstitial nephritis and somewhat hypersensitivity reaction. So this next one class is penicillin resistant penicillin. So here we just discuss this penicillin resistant penicillin are inactivated by the penicillinase enzyme. So some bacteria like Staphylococcus species produce the enzyme penicillinase that destroy beta-lactam ring. As beta-lactam ring get deployed or get open, so it becomes your penicillin becomes inactive or ineffective. So here are the example of penicillin resistant penicillin and which is isoxazoline penicillin. So this isoxazoline penicillin means in short it contains a isoxazole ring. So if you observe this penicillin which are combined or which having this isoxazole ring. Okay, so that's why it is called isoxazoline penicillin. And here the substitutions are present like X and Y. So heteroatoms are present to this and different penicillin you will get. Like if X and Y it doesn't have any substitution means just having a hydrogen, name or form of compound is oxacillin. Whereas X is chloride, so it is called proxacillin. And if this X and Y both are chloride, then it is called obvious two chloride atoms, so it is called dicloxacillin. So these are methicillin, oxacillin, cloxacillin, dicloxacillin, all are a penicillinase resistant penicillin. And because of the presence of this substituted isoxazole ring, it having a somewhat crowded environment around the beta lactam. So what happens because of this crowded environment? Yes, anyone? What happens because of this crowded environment around this beta lactam?
Steric hindrance goes on increasing.
Yes, exactly. There is somewhat steric hindrance and we can protect the beta-lactam ring degradation by penicillinase enzyme. Now about the property of oxacillin, which is a semi-synthetic penicillin. Steric effect of this 3-phenyl 5-methyl group of isoxazoline ring prevents binding of penicillin to beta-lactamase active site and protect the beta-lactam ring from degradation. So it also relatively resistance to this one is very important. It is resistance to acid hydrolysis and therefore it can be administered by oral route and it gives a good effect. Whereas this cloxacillin contains chloride group and which enhance the oral absorption and because of that leading to higher plasma level. Whereas dicloxacillin, which can be a medicinal having medicinal property and uses similar to cloxacillin. The progressive halogen substitution which increase the fractional bound to protein in plasma and reducing the concentration of free antibiotic in plasma and tissues. So in short, the plasma protein binding get enhanced because of the presence of this chloride atom. Whereas ampicillin, which is the example of broad spectrum antibiotic, which is a semi-synthetic penicillin, means we obtain it by a 6-amino penicillinic acid. So because of a alpha amino group, it is active against gram-positive as well as gram-negative bacteria and enterococci than other penicillin. So this amino group increase the ability to cross the cell wall barrier which are somewhat impermeable to other penicillin. So this ampicillin, which is water soluble and it is also stable in acid. Remember this point. Ampicillin is a water soluble and stable in acid, and it is an example of semi-synthetic penicillin. Then it can be used to treat acute urinary tract infection caused by E. coli or Protea mirabilis. And one more point regarding ampicillin is important. It is not resistant to penicillinase enzyme and it doesn't produce any allergic reactions. And it is the agent of choice against Haemophilus influenza infections. Moving to the next is the amoxicillin. So can you tell me the differentiating point between ampicillin and amoxicillin structure? Yes? This is the ampicillin structure and this is the amoxicillin structure. So what is the difference in between these two structures?
Hydroxyl group.
Yes, correct. Presence of hydroxyl group to the para position. Okay, so that's why the name amoxicillin. Okay, that's why the name amoxicillin. So about this amoxicillin, it is also semi-synthetic penicillin having a para-hydroxy analog of ampicillin. Its antibacterial spectrum is same with that of ampicillin and it is also resistant to acid, susceptible to alkaline and beta-lactamase hydrolysis. So it is not get degraded with the help of or with beta-lactamase enzyme. So it is weakly bound to plasma protein and it having an advantage over ampicillin that because J absorption of amoxicillin is more complete. So it having a less diarrhea and little or no effect of blood food on absorption. So it is doesn't absorption doesn't get affected the presence of food. So it is quite stable one. So it can be administered orally for the treatment of certain systemic and urinary tract infections. Next one is carbenicillin. So carbenicillin, which is differ from ampicillin, just having an anodable carboxyl group to the alpha carbon atom. In case of ampicillin, it having a amino group, but in carbenicillin, it having a COH group. So this carbenicillin has a broad range of antimicrobial activity and this carboxyl group improves the penetration of the molecule through cell wall barrier of gram-negative bacilli. So carbenicillin is not stable in acid and it can be inactivated by penicillinase. So it can be used in treatment of systemic and urinary tract infections caused by P. aeruginosa protease species and somewhat if it is any penicillin which are resistance or rather if ampicillin are resistance to that microorganism, so against this it can be used. Then you have to remember the structure, okay, by knowing the which are the changes. So it's quite helpful to draw a structure, common structure, and you have to remember the which are the different groups or atoms which are present, and depending upon that, you can also remember the name of the different penicillin. So these are the different examples of the penicillin and its structure. And with this, you will get that the changes or the structural differences in that different penicillin. So moving to the next one is the cephalosporin. So just we can discuss about the cephalosporin, which is also example of beta-lactam antibiotic, and it can be isolated from Cephalosporium species, and also it can be prepared semi-synthetically. It is highly potent against gram-positive and gram-negative bacteria. So cephalosporin N, which is identical with cimetine N, that is penicillin N. Cephalosporin C, so these are the three, cephalosporin P1, cephalosporin N, and cephalosporin C, from which we obtain the cephalosporins. So here the penicillin N, structure of that penicillin N, the amino side chain confers more activity against gram-negative bacteria, particularly Salmonella species, but less activity against gram-positive organism than penicillin G. Yes, it can be used for treatment of typhoid fever, but never released as an approved drug. So this cephalosporin C, which is a close congener of penicillin N, containing dihydrothiazine ring instead of thiazolidine ring present in penicillin. So this is the difference in between that your penicillin and cephalosporin. So look at the structure here.
Participants, please again join with the same link. Sir, चालेल ना?
हो, चालेल चालेल.
Recording.
And it is having a unsaturation to the carbon number 3 and 4. Yes, if you give the numbering 1, 2, and 3. So in between 3 and 4, it having a double bond. So this cephalosporin C, which was resistant to S. aureus and S. aureus beta lactamase enzyme. So its nomenclature, it contains a dihydrothiazine ring. Instead of thiazolidine ring, it contains a dihydrothiazine ring. So here is this structure, okay? So which is a 5-thia 1-aza bicyclo. Look, we have discussed the nomenclature of bicyclic cysteine. So here is again bridgehead, and to this side, how many atoms are present? 1, 2, 3, 4. 4. To this side, 1 and 2. So 2. And no any atom. That's why 0. So name is 5-thia 1-aza bicyclo 420 of 2-ene. This 2-ene indicate the presence of bond between the second carbon and third, so 2-ene. And it contains 8 atoms, so octane E gets replaced, or we get 2-ene. E indicate presence of double bond. So this is the name of that ring. So saturated bicyclic ring cysteine with with lactam carboxyl oxygen is called CFAM. This is CFAM. All commercially available cephalosporins and cephamycins are named 3-CPAMs with designated to position of the double bond. So it is called cephalosporanic acid. This is the cephalosporanic acid. And this is if you have this substituted one, we can make substitution to this acyl group. So this form, or it is the in general structure of cephalosporins. And this is the 7-amino cephalosporanic acid, 7-ACA. And this 7-ACA, which can be used as a starting reagent for semi-synthetic cephalosporin, which is the starting one, 7-ACA. So, what is the advantages of semi-synthetic cephalosporin? It having an increased acid stability, it have a improved pharmacokinetic properties, particularly it having a better oral absorption, it having a broader antimicrobial spectrum. It can be having increased activity against some resistant microorganism also, and it very important one, it having a decreased allergenicity. So all these are the different advantages of this semi-synthetic cephalosporin, and it can be having increased tolerance after parenteral administration. So all these are the many more advantages of semi-synthetic cephalosporin, and that's why in bacterial infection mostly this cephalosporin can be administered or prescribed by the physician. So it having, yes, mechanism of action is same to that of penicillin. Just now we discussed it can be inhibit the cross-linking of peptidoglycans in bacterial cell wall, and therefore it will increase the transpeptidase enzyme function, and therefore it can be kills or inhibit the growth of bacteria. So yes, it can be get degraded by chemically to the acting on a side chain 7 and substituent at carbon 3. So in strong acid solution, it can be form a lactone ring, and which is a inactive one. Okay, remember. So here is a structure like here in the involvement of this CH2OH group and COH group, and it form a lactone, and which is the inactive one. So it in presence of acid, it form a lactone, and cephalosporin becomes the inactive one. Whereas in presence of beta lactamase enzyme, it can be form a cephalosporanic acid and unhydrodeacetyl cephalosporic acid. Both are a inactive. Okay, so remember that here what happens? This beta lactamase, which is an enzyme which is responsible for the opening or hydrolysis of a beta lactam ring. As all of you know that beta lactam ring, intact beta lactam ring, which play an important role for producing the antibacterial action. And as this beta lactamase enzyme responsible for the degradation of beta lactam, and because of this, your cephalosporin becomes a inactive. So here in presence of acylates, it gets degraded, and yes, it forms a lactose. So the classification of cephalosporin, we can be classified on the basis of its spectrum of antibacterial activity, like first generation cephalosporin, second generation cephalosporin, third generation cephalosporin, fourth generation cephalosporin, and fifth generation cephalosporin. So here we discuss the spectrum of activity of this individual.
Huh?
First generation cephalosporin have broad spectrum of activity and having low toxicity. It very active against gram-positive cocci such as pneumococci, streptococci, and staphylococci. It is effective on negative rods such as coli, clavicella, pneumoniae, proteus, mirabilis, but having very little activity against P. aeruginosa, enterobacter, and acetobacter. Having it also having activity against anaerobes like Peptococcus and Streptococcus, and but ineffective against Bacteroides fragilis. So first generation cephalosporin cannot cross blood-brain barrier. Example like cephalexin, cephaloxil, cifradine, cephalothene, cephalosporin, and cefazolin. Moving to the second generation cephalosporin, which are active against gram-negative bacteria and less active against gram-positive bacteria than first generation cephalosporins. So you have to remember that the difference between the first generation and second generation cephalosporin. They are heterogeneous groups of antibiotics with different antibacterial activity. They are active against Enterobacter, Proteus, vulgaris, Clavicella, H. influenza, Example like cefaclor, cefamandole, cefuroxime, toracarbate, cefoxib T. Third generation cephalosporin. Okay, so which are less active than first generation drugs against gram-positive bacteria, but much expanded spectrum of activity against gram-negative microorganisms. There are a few examples like Citrobacter, Enterobacter, Pseudomonas aeruginosa, then beta-lactamase producing Meningococci and influenza. Against it can be these third generation cephalosporins are effective. So they are used in treatment of sepsis of unknown origin also. So the all third generation cephalosporin except cefoperazone and cefixime can cross blood-brain barrier, and therefore it can be used to treat meningitis. Meningitis is nothing but the inflammation of the meninges, which are the protective layer of the brain. So example like cefotaxime, ceftriaxone, then ceftazidime, cefoperazole, which is the third generation cephalosporin. Fourth generation cephalosporin example like cefepime, cefpyrone. Fifth generation cephalosporin, which are having extended spectrum of activity. Example ceftobiprole and ceftaroline. So all these are the classification which are depending upon the spectrum of antibacterial activity. There are another way of classification and which are depending upon is route of administration. So you have to remember this, which is very important one. Mostly it can be used, give the example or choose the correct cephalosporin which can be administered by oral route, which can be administered by parenteral or by oral as well as parenteral route. So here we discuss example of orally administered cephalosporin. Examples are cefalexin, cefadroxil, cefaclor, cefprozil. Whereas parenteral cephalosporin, which can be administered by parenteral route, example cefalothene, cefazolin, cefamandole, cefoxythene. And one more example can be administered orally as well as parentally. You have to remember the name of these cephalosporin, which can be administered by both oral as well as by parental route, and which is cifradine. Okay, so cifradine, which can be administered by orally as well as by parental route. So here is the cephalosporin. So which is a semi-synthetic cephalosporin. The alpha amino group of cephalosporin make it acid stable and reduction of free acetoxymethyl to a methyl group which avoids the reaction at that site. Okay, so the modification we made to that. So as we see this acetyl group which are present here, so which is responsible for the degradation, but we replace it by simply methyl group, and here which are structure is same to that of the ampicillin, but here is the 6-member ring and it having a methyl group. So this modification which can be made a quite stable one. It
So
can
your
be
session is so interesting. Very sorry to interrupt you, but can we have a little question answer session and then vote of thanks now?
definitely. Yes.
Students, first of all, I request you to please give your feedback first. Yes. Say a few words, whatever you understand, or should we ask you a few questions?
Yes. You have any questions?
सर हवं तर पीपीटी एकदा दाखवून द्या हवं तर जे घ्यायचं होतं. Actually, it is so vast. 20 to 22 hours are allotted for that. Very thanks to my students for listening to this. And
I'm also very thankful to Principal Dr. Kai sir, Mohan Kai sir, for giving me this opportunity. I am very thankful to Dr. Ujwala Thube madam for giving me the platform, okay, in this webinar. And I am also thankful to all students for giving the full attention. So I just show the slides. So I'm not getting feedback from student. All of you getting?
Yes, please reply, students. Any one of you say few words, please. Okay, I also like to express my deep sense of gratitude and thanks to Dr. Amit Lunkad sir for illuminating us with his knowledge about antibiotics. Actually, there is so much to tell or express here. If you wish, you can refer his YouTube channel as well. There you can get maximum information. Thank you, Aditi Gare. Thank you, students. You can give your feedback through chat also. I would also like to express my deep sense of gratitude and thanks to our management and our college development committee members. Special thanks to our beloved principal, Dr. Mohan Kale sir, for always guiding and motivating us to do such events and helping us to welcome such chief gesture for getting very good depth of knowledge. I would also like to thank our teaching staff, all the teaching staff, all the non-teaching staff, as well as supporting staff, our computer experts, and all the team of KJRDCP and RI. Thank you, all of you. And obviously, thanks to my dear students for giving such a special response for all the events organized by us. Thank you so much.
Once again, thank you.
Thank you, sir.
And best of luck to all.
Students can
Thank
unmute and say thanks or say a few words till the
Thank you,
meeting ends.
sir.
Thank you so much, sir. Thank you, sir.
यानी आपकी पूरी मीटिंग खत्म होने के बाद तेल होने को स्टैंडर्ड करेंगे वो तीन
Here we conclude our session. Again, thank you, sir, for your nice cooperation for organizing this session, your acceptance, and giving importance to our invitation. Thank you so much, sir.
Thank you, madam.
Recording stop.